Hi, I'm Dr. Julie Steinauer. Let's talk about an old but a new treatment that's being utilized for patients who might want to get rid of their glasses for reading and near work. But before we go into that, let's talk about how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, then go to our website at visionforlifeworks.com and you can either click on the schedule a consultation or you can fill out a questionnaire for us and then we'll chat with you about how we can help you. Now let's go back to talking about an old but a new treatment. And the old treatment, it's been around for a long time. It's called pilocarpine. Pilocarpine is a medication that's used for a couple different things. First of all, it's used for glaucoma patients. And with glaucoma patients, it's used to lower their eye pressure. It's also used for patients who have something called Sjogren's syndrome, where in Sjogren's syndrome, there's a problem with the salivary glands, and so they often have a lot of issues with dry mouth. And what's interesting is that pilocarpine can stimulate the salivary glands to produce saliva in the mouth and help the mouth not be so dry. Now, you can also use pilocarpine for patients who maybe have gone through cancer treatments with either chemo or radiation that may have affected something like the salivary glands and some dryness in the body, and pilocarpine can be used for them too. So there are many good uses for this medication. The suggested use that's coming out because of one of the qualities that it has, which is to create a constriction of the pupil, is to use this medication for patients who want to get rid of their glasses for near work and who, if your pupil is constricted, it will help you to focus better, so you might be able to see things up close without necessarily needing to wear glasses. Now, there's a downside to this, one of which is that it wears off after a couple of hours. So it's kind of shelf life for how it affects you, and the usability of it is about 6 hours. The other possibility of, some negative things are that pilocarpine does have some systemic effects. And what that means is it affects you throughout the whole body because it tends to mimic something called a parasympathetic reaction in the body. It means that it increases your rest and your digest phase or part of your neurological system. So it's going to kind of increase things like gut motility or intestinal activity. In some patients, that might mean that it could cause them to have, GI upset and diarrhea. It's also going to do things like kind of as well increase things like the ability to feel like you need to go to the bathroom, so it increases urination. It can cause some different things to occur with the heart rate. So there are a couple things that could be potentially negative about it. While it is a medication that's useful and has a lot of great uses. Some patients can also experience tremors and headaches as a result of using pilocarpine. So these are just kind of, think about them. And now let's talk about, well, is there actually an alternative way to do this, to make it so that you can see better, more clear up close without necessarily needing to have reading glasses without using a medication that could potentially have some side effects, even though it's a great medication. So I'm going to talk to you a little bit about photosynthonics and light therapy. So you hear me talking about photosynthonics all the time. It's one of my great loves. In fact, it's a huge passion of mine, and I use it with all my patients in the clinic. But being able to train the brain how to have flexibility of focus again doesn't just include using something like Synthonics filters, although it does, but it also can include using something like lens flippers that can train the brain how to have some flexibility back in that system for focusing again. And there's another activity. Let me just see if I can grab something. I don't actually have what we use in the clinic, which looks like a pencil, and it has some numbers and things on it, but I'll just show you, like anything will do, even something like our pen that has some details on it. So what you can do is you can take that pen with details on it, and you can hold it out where you're nice and clear with your eyesight, and then you can bring it in towards your eyes when it starts getting kind of fuzzy and blurry, and then you take it back out. And you kind of go in and out, almost like you're stretching a rubber band, all right? And what that does is it actually does help to kind of stretch or release some of your brain's ability to focus and accommodate. Now, you're not going to do that just once and all of a sudden be able to read a menu if you're at the restaurant without your glasses. But some of these activities, again, using photosyntonics to kind of retrain your brain how to focus, using some lens flippers, using this activity, as well as a whole host of other things, can actually help you to gain back your flexibility of focus for near, and maybe, just maybe, gets you to the point where you don't require wearing glasses for every single thing that you do for near work. Now, if you'd like to learn more information from us, you can go to our website at visionforlifeworks.com, fill out a questionnaire, or click that schedule a consultation button if you want to schedule an online consultation with me. Or if you're local, you can call us at 618-288-1489. Make sure that you hit the like button on our video and follow us. You can follow us on Rumble and on YouTube. Thank you.